I'm Dr. Scott Cordray with Ear, Nose, and Throat Inc. You may be a patient that has pain, pressure, headache for more than 12 weeks that has not responded to the typical medicines that we use for sinus disease, or you could have recurrent sinus infections that haven't responded to antibiotics. Typically what happens, the sinuses and the inside of the nose, the mucosa, the skin if you will swell. It'll block the sinuses off. Then you have mucus that's trapped in a warm, moist, dark area, basically a setup for infection. The remedy for that, if medicine doesn't work, is the possibility of using balloon sinuplasty. Inserting a balloon to the opening of the sinus and inflating that balloon so it opens it, and it does it in a permanent way. Now the mucus that was trapped in there can get out, air can get in, and it restores that sinus to a normal, healthy state. The balloon sinuplasty addresses those specific issues that really can't be addressed with medical medicines. For instance, if you're taking many antibiotics, or if you're taking nasal steroids, decongestants, antihistamines that are now over the counter, and it goes on for more than 12 weeks, you could be a great candidate to have your sinuses ballooned open so they can get back to a normal, healthy state. So in summary, if you have pain, pressure, headache that's just not responding, recurrent sinus infections, those are wonderful indications that you might be a great candidate to have balloon sinuplasty. The advantage that we can offer opening sinuses with balloon sinuplasty is primarily with stereotactic technique. This technique, once only offered in the hospital, is now offered in only a very few ear, nose, and throat doctors' offices. This is the machine that we use. In other words, stereotactic gives us the capability of inserting an instrument in your nose up to the opening of the sinus so that we can see exactly where we're at in 3 different images, so that we can do it safely and we can do it more completely. That will give us the advantage of making it better outcome, less recovery, less bleeding, and certainly less pain. Another advantage of having this technique done in the office versus having it done at the hospital typically will give you 3 charges. 1, the hospital charge, which is usually enormous, an anesthesia fee, and a surgeon fee. In this way, you get 1 fee. And obviously that's going to be dramatically less because we're able to accomplish this in the office, whereas it used to take all 3 of those resources in the past. So if you feel like you're in that category where you have problems with your sinuses, pain, pressure, headache, you can't breathe out of your nose very well, you have constant nasal congestion, or if you just have recurrent sinus infections that are interfering with your lifestyle, call my office, make an appointment. We'll sit down in consultation and we'll figure out if you're a good candidate for this procedure.